Hey, you are listening to Medica Talks, which brings to you all the exclusive healthcare industry news, views, and opinions from across the world.
Hello listeners, I'm Urvashi. Today we will discuss about tobacco-free future addressed by Dr. Rohan Bartake, who is a tobacco de-addiction expert, tobacco treatment specialist in India. He is the founder of Quit Buddy Tobacco De-Addiction Program. He is also charter president of Rotary Club of Addiction Prevention 3141. He has counseled more than 5,000 patients. He has conducted tobacco cessation training courses for doctors, nurses, and healthcare professionals. Hello, Dr. Rohan. Welcome to our podcast for patients, caregivers, and healthcare professionals at Medica Talks. Dr. Rohan, can you tell us why is tobacco so harmful?
Hi Urvashi. First of all, thank you for inviting me for the show. Yes, we need to know why is tobacco so harmful. For that, first of all, we need to understand from where does tobacco come from. We need to understand certain basic things about tobacco. So tobacco comes from tobacco farm. There is some speciality of this tobacco farm. This tobacco farm is the only farm which doesn't require fencing or any protection. We don't need to protect this farm from animals because even animals don't eat tobacco. Yes, you heard it right. Even animals don't eat tobacco. So if animals don't eat, is it something that human beings should eat? So we need to understand why animals are not eating it. So if you take the tobacco leaf from the farm and give it to the laboratory, just to understand what are the different chemicals present into it, even at that time, when the tobacco leaf is present in the tobacco farm, there are a lot of chemicals which are hazardous to the body. It is not an edible plant. There is nicotine also present at that time. Over a period of time when cigarette making companies prepare cigarettes and gutka making companies and other tobacco products are prepared, a lot of more chemicals are added into it. A lot of hazardous chemicals are added into it. So due to the latest survey shows that when a person is smoking one single cigarette, he is exposed to almost 4,000 to 7,000 chemicals, out of which 200 are proven poisonous, 60 to 65 are proven carcinogenic. Carcinogenic chemicals are those chemicals which have capacity to produce cancer. So imagine a person consuming tobacco products every day. He's consuming so many carcinogenic chemicals day in, day out. So it is bound to impact your body in a big way. And what are these chemicals? You have ammonia in your detergent powder, you have cadmium in your batteries, you have acetone in your paints. So are you going to eat your detergent powder or eat your batteries or drink your paints? We are not going to do that because we know these are poisonous chemicals. But a person who is consuming tobacco is actually consuming these hazardous chemicals every day.
What are the different types of tobacco products?
Tobacco is broadly divided into two major categories: smoking and smokeless tobacco. Smoking tobacco includes those products which need to be burnt and smoke come out of it, like cigarettes, BDs, hookahs, cheroots or cigars, and electronic cigarettes. Smokeless tobacco has a very big range in India. We have different types of smokeless tobacco in India. Every state has its own speciality. Every state has a different method of consumption and different brand names. Packaging is different. So some basic products like tobacco with silk lime or chuna, khaini, gutka, mawa, pan with betel leaf, and tobacco with areca nut. So these are n number of tobacco products. There are sophisticated tobacco toothpaste by the brand name of Ipco and Dentobac also. So there are n number of tobacco products across the country.
What are electronic nicotine delivery systems and how are they harmful?
Electronic nicotine delivery systems are the latest addition to the tobacco products. It is just a device which contains nicotine in a liquid form. And because there are batteries into it, the combustion happens and smoke come out of it. They are available in different forms and shapes. They're called as joules, mods, e-cigarettes, but the mechanism remains the same. There are batteries into it, because of it the combustion happens and tobacco is present in the liquid form. Now, because the only difference here is that tobacco is present in liquid form, it has the same impact on the body. Many countries have totally banned electronic cigarettes. India has also banned electronic cigarettes completely from 2019. So you need to understand this is getting popular among the youngsters and it is also considered something as a harm reduction technique, which is absolutely wrong. World Health Organization has not approved any of the electronic cigarettes. So you need to be very careful.
What are the misconnects regarding tobacco consumption?
There are many misconceptions related to tobacco and tobacco products, like cigarettes and BDs. People feel cigarettes have filter into it, so they are safe. BDs don't have a filter, so they are harmful or more harmful. But there is nothing like that. Try to understand three major things over here. First of all, no matter what tobacco product it is always going to be harmful. The moment you see there is tobacco present into it, it is definitely going to harm your body. Second is no matter what quantity you are consuming it, it is still going to be harmful. There will be people who will tell you that I have one cigarette or one gutka, but still it is going to be harmful. And third is no matter what duration you are consuming it. It's not that only after consuming tobacco for 5 to 10 years, only then you will land up into cancer and other deadly diseases. Even after consuming tobacco for a shorter duration, you can still land up into major illnesses. You must have seen an advertisement when you go to watch movies. There is a guy named Mukesh who is a young guy of 24 years old who had just started taking gutka for not more than 4 years, but he actually landed up into a cancer and he actually died during the treatment. So this is a practical example, a real case which was admitted in Tata Memorial Hospital. So you need to understand even after consuming tobacco for shorter duration, you can land up into major illnesses. Apart from this, there are other misconceptions like tobacco can relieve your constipation. People feel that tobacco can be used to relieve your constipation and have smooth bowel movements. But this is again absolutely wrong. The person who says that he is consuming tobacco just to have smooth bowel movements must have started consuming tobacco at the age of 15 and above. So first 15 years he was still having smooth bowel movements without tobacco. Second is if he has good fibrous food in the diet, it will help into stool formation and he won't need tobacco for it. Third is you can have hot water, hot tea in the morning. So it will have a gastrocolic reflex and peristaltic movements will happen. So he need not take tobacco for it. Apart from this, if he's still having problem, he can go to a doctor and take medicines for constipation. No doctor will ever prescribe that have 3 gutkas or 3 cigarettes as a treatment. So try to understand tobacco is not a medicine and it should not be taken as a medicine. One more thing people have a strong misconception is tobacco relieves your stress. But try to understand when you are taking tobacco, you are actually consuming so many chemicals, hazardous chemicals. So tobacco in no way is going to reduce your stress, but it is going to harm your body and increase your stress in a big way.
What are the short-term and long-term effects of consuming tobacco products?
Tobacco affects the body in a big way. In short term, it causes ear infection, sore throat, yellow and decayed teeth, bad breath, smelly hair, or loss of sensation of taste and smell. It causes early wrinkled skin. It causes itching in the eyes, watering eyes, dark circle below the eyes, and it reduces the ability to think and concentrate. Consumption of chewing tobacco for more than 3 years causes white patches in the mouth called as leukoplakia, red patches in the mouth called as erythroplakia, or the mouth opening starts reducing, which is called as submucous fibrosis. It also causes some non-healing ulcers, the ulcers which don't heal easily. And 90% of reason for oral cancers is consumption of chewing tobacco.
What are the types of cancers that can be prevalent due to consumption of these products?
Smoking is a risk factor for many life-threatening illnesses. It causes cancers of more than 16 different body parts. It causes chronic bronchitis, reduced lung function, asthma, coronary heart disease, heart attack, emphysema, gum diseases, tuberculosis, also diabetes, early cataracts, gangrenes, paralysis. It affects the nerves and causes stroke, macular degeneration of eyes, and also causes impotency in men. Even in women, it causes infertility, miscarriage, stillbirth, low birth weight babies, sudden infant death syndrome. So, it is one of the major causes of infertility in women.
What are the benefits of quitting smoking?
As soon as a person stops consuming tobacco, there are a lot of good changes happening in the body. A body has a mechanism to do continuous repair. Try to understand, for example, when you fall down and get an injury, that injury won't last for lifelong because there is continuous cell regeneration happening in the body and there is a repair going on. Similarly, when a person stops consuming tobacco, from the moment he has stopped consuming tobacco, there are good changes happening in the body. So there is a proper research available today. What are the good changes happening from 20 minutes of quitting smoking to 15 years of quitting smoking? So within 20 minutes, your pulse rate and blood pressure gets back to normal. Within 12 hours, your carbon monoxide level drops to normal. Within 2 to 12 weeks, your lung function test starts improving. Within 6 months, your chest congestion goes away. Within 5 to 10 years, your risk to heart attack, stroke, paralysis drops by 50%. Within 15 years, you are as good as a non-smoker. Means a person who has never smoked and a person who has quit smoking 15 years back come on the same level for any cardiovascular disease risk. So can you imagine to what level your body can do repair? So the earlier your person comes out of this habit, the earlier the body will get chance to do this repair and come back to normalcy.
How do people fall into the trap of tobacco consumption?
People start consuming tobacco in spite of the fact that it is harmful because there are a lot of internal factors, external factors and environmental factors influencing them. Internal factors such as wrong belief regarding tobacco. People feel that cancer won't happen to me or they feel that I'll try just once. But they are not aware that nicotine is one of the most addictive substance and they get into the trap of addiction. External factors like family members or close society members are in the habit and from them they learn this habit. Environmental factors such as how it is showcased in media and marketed in our movies, people get influenced by that. So people feel that it is stylish, a macho image is created with this. So there are a lot of wrong beliefs associated with it. People feel that it relieves stress or it relieves constipation or it helps in overcome depression. So all these things lead to the habit.
Is there any cessation facility to quit tobacco?
This is a very important question because people are not aware about tobacco de-addiction. People feel it's impossible or very difficult to quit tobacco habit. But the fact is, it is definitely possible to quit. And if the help is provided and a hand-holding is provided by an expert, the chances of quitting increases almost 4 times. I have personally counseled more than 5,000 patients and my success rate has been above 50%. So we run a Quit Buddy program which include a 5-step program. So step 1 includes nicotine addiction screening and assessment, understanding tobacco with respect to different spheres of life, introspection and readiness identification. Step 2 includes trigger factor analysis and designing a customized quit plan. Step 3 includes trigger factor management and plan optimization. Step 4 includes risk management and withdrawal management. And step 5 includes follow-up and maintenance. So this is a well-proof program customized to help people to get out of the tobacco addiction.
So, Dr. Rohan, what is the message that you would like to give to the society?
My message is very loud and clear. There is urgent need for tobacco de-addiction in India. On one hand, we need to save our youth from getting into this addiction. On the other hand, we need to help these people who are already into the consumption to get out of this habit as early as possible. We run a program called as Quit Buddy program, which helps people to get out of this addiction. We urge people to join us in this Quit Buddy program and help more and more people to spread the awareness about the hazards of tobacco so that we prevent our young generation from getting into it, and also spread this awareness among the consumers that it is possible to quit, and it will help many families, and we can prevent many productive age group people losing their lives. So come join hands with Quit Buddy program and be Quit Buddy volunteers and spread this message to more and more people.
Thank you, Dr. Rohan, for being a part of Medica Talks and sharing your insights. We are hopeful that it will lead to the betterment of the society.
Hey listeners, I hope this podcast was beneficial for you. Don't forget to stay tuned with us for our next podcast session, where we bring to you all kinds of healthcare industry news, views and opinions from around the world.